Hello friends, let's revise surgery quickly. First point, acetohydroxamic acid. Acetohydroxamic acid is used in the treatment of white stone, and this is urease negative. Second point, second is this cystoscopy finding. It is the interstitial cystitis. It has the three characteristic fissures, punctate hemorrhages, and Hunter ulcer. This condition is sacrococcygeal teratomy, and treatment is by surgery resection by through posterior approach, and chevron incision is given in this one, okay, to treat one. So n block resection of tumor and coccyx is done for coccygeal teratomy. So here is a radiograph of this sacrococcygeal teratomy. Next one, nephrogenic systemic fibrosis, NSF. This is due to gadolinium contrast used in MRI. That is the side effect causing nephrogenic systemic fibrosis, and it may also affect other organ, not only kidney but other organ too. So next point, we see this thrombosis in axillary artery. So what is this? This is compression of subclavian vein between anterior scalene clavicle and first rib. So this is a clavicle, and here is first rib and the anterior scalene muscles, and in between them this subclavian vein is compressed. So this condition is known as Paget-Scrotter syndrome, and it is causing axillary subclavian vein thrombosis, and it gets exaggerated by exercise. So we see this 5 different stomach condition, and this is the modified Johnson anatomical classification for gastric ulcer. So type 1 is on lesser curvature at incisura, and this is the most common one. Here the acid content is less or normal. Type 2, this is on gastric body, and this is with duodenal ulcer. So gastric body and duodenal ulcer, type 2. Type 3 is pre-pyloric condition, and in type 2 also 2 and 3 gastric secretion of acid is increased. Now what's type 4? Type 4, it is high on lesser curvature, चढ़ गया है ऊपर, 4 चढ़ गया, so high on lesser curvature. Here acid secretion is normal. And type 5 is anywhere in the body, that is due to anesite, but that is due to anesite induced, and acid secretion is here also normal. Next point, maximum safe cold storage time for various organ. For kidney 36 hours, for liver 18 hours, for heart it is 6 hours. So this condition, neck swelling, and here is the pictorial diagram. This is a patient living in high altitude area, and this is very slow growing tumor. This is carotid body sinus tumor, and here a Lyrae sign is seen. So we see this Lyrae sign. Angiogram shows splaying of carotid bifurcation. So here is a space between two carotid artery is increased, I think this one, okay. Here also we see what is different type of urethral injury. It can be membranous urethral injury and bulbar urethra injury. So on digital rectal examination, high riding prostate is noted, and this is known as Vermeulen sign. Vermeulen sign. This is in membranous urethra, and pelvis fracture is also noted. But in bulbar urethral injury, there is perineal bruising and hematoma. There is direct blow to perineum. Sorry. Next one. So we see this resected mass of breast, and here is the mammography. Okay, mammogram. This is local wide resection done for phyllodes tumor, also known as cystosarcoma phyllodes or serocystic disease of Brody. Serocystic disease of Brody. This is usually found in more than 40 year of female, but it can be found in early age also. It is mostly benign condition, and this mass is mobile over chest wall. Mobile over chest wall. And if it is benign condition, then local wide resection is done. And if it is massive, then mastectomy is preferred. Next one. Peripheral occlusive disease. Peripheral occlusive vascular disease, most common presentation is intermittent claudication, and this is due to decreased blood flow. And sometimes sunset foot sign is also noted, that is in critical limb ischemia. Next, abnormal ascent of metanephros leads to ectopic kidney. Abnormal ascent. Next, medullary sponge kidney, that is associated with recurrent urolithiasis. This results from collecting duct ectasia causing medullary sponge kidney. Okay, so this hand forearm injury, this is the degloving injury. So this is skin plus subcutaneous fat is stripped off from underlying fascia. This condition, here we see the inflation of a stomach and then insertion of a trocar and then a peg tube through abdomen. This is placing gastrostomy tube. Placing of gastrostomy tube, and the procedure is PEG, percutaneous endoscopic gastrostomy, PEG, percutaneous endoscopic gastrostomy. So here is the picture. Next condition. So we see in this splenic artery aneurysm. This is angiography of abdomen. So this is showing splenic artery aneurysms. This is more common in female than male, and this is usually asymptomatic. Patient is usually asymptomatic, and the pregnancy is the risk factor for rupturing. Pregnancy is a risk factor, and all cases do not require surgery. And the elderly patient with calcified aneurysms, there is decreased risk for a rupture. Decreased risk of rupture. Now, next condition, we see this diagrammatic picture of abdomen. Okay, so uterine artery crosses ureter anteriorly. So we see here the ovarian artery, and this lower one is the uterine artery. This is anteriorly placed to ureter. So this anatomy is topography is very important in hysterectomy. What is the sliding inguinal hernia? Sliding inguinal hernia. Where is the position? Deep. This is at deep ring lateral to inguinal, inferior epigastric artery. So sliding inguinal hernia is placed in a deep ring lateral to inferior epigastric artery. Okay, the next condition. So TMPRSS2 ETS fusion gene. TMPRSS2 ETS fusion gene. This is present in almost 50% cases of prostate cancer. Next condition is the pinoscrotal hypospadia. Pinoscrotal hypospadias. When is the ideal time for surgery? Between 6 to 8 months of age. Next condition. This is VATS, video assisted thoracoscopic surgery. So this picture is showing Bosniak classification for renal cyst. So salivary gland. Next condition, salivary gland tumor. So hot spot in the technetium 99 scan is showing Warthin tumor. Okay, and this is usually unilateral condition. Lower pole of the gland is involved. This tumor is slow growing and it is encapsulated cystic. FNSC can be used, and treatment is superficial parotidectomy. Next condition is Poland syndrome. This is the absence of one or both breast with absence of external portion of pectoralis major. Next, largest artery of stomach is left gastric artery, LG artery. Next condition is UPJ obstruction, uretropelvic junction obstruction. The treatment of investigation of choice is MAG3. So this should be investigation of choice. So investigation of choice is MAG3. Next, what is D of melanoma? ABCD of melanoma. In that, what is D? This is the diameter of lesion is more than 6 mm. Next, Wilkie syndrome. This is what? Duodenum, third portion of duodenum, it's compressed by superior mesenteric artery. This is a rare condition. The third part of duodenum is compressed by superior mesenteric artery. Next condition is so tumor marker in detection and management of HCC, hepatocellular carcinoma. This is alpha fetoprotein. Next and last, palpable nodules over prostate. It indicates carcinoma of prostate. So thank you very much. Please like and subscribe my channel.